How do subtle procedures create significant feminization in FFS? Imagine transforming a face with small, precise changes that add up to a completely different look. That's exactly what subtle procedures in facial feminization surgery do. They target specific facial features to soften masculine traits and highlight feminine contours. These adjustments may seem minor on their own but work together to create a natural, balanced appearance. The face is made up of many regions that show gender differences. The forehead often has a prominent bony ridge and a higher hairline in men. By reducing the ridge and lowering the hairline, surgeons create a smoother, more vertical forehead. This change makes a big difference in how the upper face appears. The jaw and chin are usually wider and more angular in men. Gentle reshaping or shaving of the jaw angles and chin can narrow the lower face. These small tweaks produce a softer, more oval or heart-shaped look that is typically associated with femininity. Sometimes, the chin is made smaller or rounded to match these new proportions. Cheekbones also play a role. Feminine cheeks tend to be fuller and gently curved, not sharp or angular. Surgeons can add volume with implants or fat grafting, or reduce overly prominent cheekbones to achieve this effect. These subtle changes help balance the face and soften its overall appearance. The nose is another key feature. Rhinoplasty, or nose reshaping, can refine the size and shape of the bridge and tip. Narrowing the nose or softening its profile helps the face look more traditionally feminine without drastic alterations. Lip feminization is also important. Lifting the upper lip exposes more teeth at rest, giving a youthful, soft smile. Lip augmentation adds gentle volume, making the lips look more delicate and expressive. Reducing the prominence of the Adam's apple in the neck, called a tracheal shave, smooths out the neck contour. This small procedure removes a distinctly masculine feature and enhances overall femininity. All these tiny adjustments work together to reshape the facial skeleton and soft tissues. The goal is to reduce masculine angles and emphasize curves and gentle contours. The result is a face that looks naturally feminine and harmonious. In transgender and gender-affirming care, these procedures are personalized. Surgeons use 3D imaging and measurements to plan each step carefully. The subtle changes are designed to match the individual's facial structure and goals. This approach helps people feel more comfortable and authentic in their appearance. So, even though these procedures are small, their combined effect creates a significant transformation. They soften the face, balance proportions, and help individuals present a more traditionally feminine look. This supports mental well-being and helps with gender congruence in everyday life.